Well, I hope you're having a good day wherever you are and wherever you're listening to this and watching this. This is the Cancer Survivors Park Alliance's Cancer Prevention and Wellness Series. I'm Jeff Jaguar. I'm your host. We have been doing this content for about 4 years now. It was initially done within the park in our Center for Hope and Healing. And it required that not only you be there at a specific time and date, but at a specific location. And then, of course, 2020 happened, and with the pandemic, we had to adjust like everybody else did. And so we had content that became available via Zoom, a lot of didactic stuff, but conversational as well. All those recorded sessions via Zoom exist on our Cancer Survivors Park website, which is cancersurvivorspark, all one word, .org. You go to the link that's the tab that is programs, and then go to virtual programs, and they're all lined up there. And what we have historically talked about is lifestyle modifications for cancer survivors and people that are trying to avoid a malignancy based on their family history or potentially a genetic predisposition. And we basically are asking them to get rid of some of the bad habits and kind of emphasize the good ones. So, get rid of bad habits like smoking and drink in moderation, not in excess. And really, it comes down to you are what you eat. So a whole food, non-processed food as much as possible, a closer to a vegetarian diet, but anything that is more vegetables, more fruits is going to be a benefit to you as far as a cancer mitigation strategy. We emphasize exercise. We emphasize getting adequate sleep. We exercise being social, having social contacts. And we also emphasize mind-body techniques, those that are data-driven, scientifically proven. And those include meditation, and the meditation comes in many different forms, yoga, but there's lots of different things that change our emotions, mind, body, and soul. We estimate that over 50% of cancers are preventable. So there's lots of things that you can do, the way you live, the way your lifestyle changes that can prevent malignancies. So with that, I'd like to introduce a subject that we have, after 4 years, not really broached before, and that's music. And it seems very intuitive that music would be kind of a no-brainer as far as making emotions better, and really inspiring folks. But we really want to get it from a person who's got expertise in this and actually does this for therapy. So we want to welcome Bridget Brennan, who's a musical therapist in town. Welcome.
Hi, thank you so much for having me, and thanks everybody for taking time out to come and listen.
Yeah, and you have a very pretty smile and a great Irish face.
Thank you.
So tell me a little bit about your individual practice. What you're doing now. You may have more than yourself that's doing this for therapy around the upstate and whatnot. But tell me about what you do and how you got to where you are.
Thank you. My name is Bridget Brennan. I'm a board certified music therapist. I'm coming up on entering my 5th year of being certified, which means I get to do my continuing education credits.
Right, time to renew, right?
Yeah. So I am the director and music therapist for my own private practice called Blue Ridge Creative Therapy, LLC. Right now it's just me. So I have let's see, I started about 3 years ago, and before I came and started my private practice, I was working in hospice music therapy down in South Florida.
Okay. Yeah, good.
I also had a hospital there and working with the cancer group as well. There was a group therapy we did for music therapy.
And how many instruments do you play?
Well, my main instrument is flute, so I'm a classically trained flute player. And then for music therapy, so you have to go to school and get a degree in music therapy. Along with that is all your normal music classes, plus things like, basic anatomy, psychology, a few extra things added in there. So we do all of that, and then at the end of that, we have an internship that we go to. So I believe it's about 10,040 clinical supervised hours
Wow.
between the practicums you do in school and the internship, which is usually about 6 months.
Okay. Did you
So
come from a musical family?
yes, I did. Um, my mom played all the woodwinds and my dad played brass. And so they taught music out of our home. And I wanted to play flute so that I could sound pretty like my mom. So I
Wow.
played flute, guitar, ukulele, piano, I sing, and I most recently started learning Irish whistle.
Oh, I'll have to get a sample of that. Uh, there's a whistle that's confined to Ireland.
Yeah. Well, now it's all over the world, but
Yeah. Well, it originated in Ireland.
yes.
So, in your practice, in the last 5 years, since you've been board certified and whatnot, what kind of medicine, what kind of patient? I know you talked about hospice and you talked about some cancer intervention, and I know you're going to emphasize for this program the cancer patients, but what other things have you had impact on in your career?
Yes, so now I spend most of my days working with kids who have special needs. So 4 days a week, I'm at a local center for children who all come there. It's ages infant to age 8, and they're pre-K. So we're getting them ready to be integrated into the school systems. So those are diagnoses like, the bigger ones you're probably already heard of: autism, Down syndrome, ADHD, all the way down to more rare syndromes, like Rett's. And then I have some individuals that I see in the school systems, here and in Pickens County. And I have some nursing homes that I go to. So that's a memory care unit and a rehab unit as well. So they're getting like higher levels of care. So I do that twice a month, and then I have another person I see individually who has dementia. And she was a piano player, so we just get together and I play flute or sing. And
Wow. So they remember the music.
yeah, the music
Yeah.
brings back those memories, especially when it's music from our younger years.
Yeah. Trisha Yearwood, the song Remembers When, is a good lesson for, music always comes back. I mean, I can give you lyrics from the 60s that I can't tell you what I ate for breakfast this morning. All right, well, I'll let you get started on
Right,
your
that's exactly it.
presentation, and I guess you're going to take us through a little bit of therapy first.
Yes, so I thought I would provide a music experience. I always recommend go ahead and get comfortable. If that means you want to close your eyes and lean back, if you want to turn off your screen, whatever makes you the most comfortable. And you probably want to sit down in a chair, have your feet flat on the ground. And so a progressive muscle relaxation is just an exercise we use to reduce stress in your body. So I'll go through different body parts, like starting with feet all the way up to your face, and we'll just tense them up. And when it's time to release, I'll guide you to release that. So give yourself a little bit of tension, but don't make yourself uncomfortable. More is not better. Just tense and release, and don't forget to keep breathing through it. We want to take as many deep breaths as we can. And also, if you have any pain that you notice while you're doing this, just stop doing that exercise and pick it up on the next area of your body that we go through. And we're just going to pay special attention to the feelings in our body. So sit back down or lay down in a comfortable position. Close your eyes if you'd like. Take a deep breath in. Notice the feeling of the air filling your lungs. Hold your breath at the top and then release. We're teaching our body to hold the tension and release it when they want it to. Another deep breath in through your nose. Hold it there and release. Let's take one more deep breath in together. Breathe in, fill your lungs. Hold it there and slowly release. Imagine the feeling of tension leaving your body. Now, put your attention on your feet. Begin to tense them by curling your toes and curling the arch of your foot. Hold that tension. Notice what it feels like. And we're gonna breathe in. And when we breathe out, we're gonna release our tension in our feet. Go ahead and release. Notice that new feeling of relaxation. So now we'll begin to focus on our lower leg, tensing the muscles in our calves. Hold that tightly and feel the tension. And we're gonna take a breath in and then release. So breathe in now. And when we exhale, we're gonna release the tension in our legs. Just keep taking deep breaths. Next, we'll focus on our upper leg area. Just tightly squeeze your legs together. And feel the tenseness without going to the point of strain. Breathe in and then release. Feel the tension leave your muscles. Now we'll begin to tense our stomach. Sucking your stomach in, squeeze harder and hold the tension. Hold it just a little bit longer. Then we're going to breathe in and release. Ready? Breathe in. Breathe out. Let your stomach relax. Allow your body to be limp. And let yourself notice the feeling of relaxation. Continuing to take deep breaths. Observing that air fills your lungs. And feel the air Tense shoulders up high, holding them tightly, up, up, up. Tense them hard, but without straining. Take a deep breath in, and we're gonna release in just a second. And exhale. Let your shoulders come back down. Breathe in. Now tense your arms all the way from your hands to your shoulders. Make a fist. Squeeze all the way up your arm. Hold it. And take a deep, noticing the feeling of relaxation in your fingers, in your hands, in your arms and shoulders. And notice how your arms feel now, limp and at ease. Next, we'll go up to our neck and head and just squish your face up. Squish your face. Feel that tension in your face. And breathe in. And we're going to exhale and release your facial tension and release. We have new feelings of relaxation. We're noticing tensing our feet, legs, stomach, chest, arms, head, and neck. Tense hard. Hold it. Breathe in and release everything out. Allow your whole body to go limp. Pay attention to the feeling of relaxation. How different that is from the feeling of tension. Now you can start to wake your body up by slowly wiggling your toes, wiggling your fingers, maybe adjusting your arms, legs, and shoulders. Stretch your muscles, and you can open your eyes gently when you're ready. And that concludes our progressive muscle relaxation.
That was great.
Thank you.
I think we're being affected by some solar activity. The audio has been a little bit not up to par, but it's fine. It's fine. I think the concept, I can tell you what's the techie question here is there an app for that?
Yes, there are lots of apps. I think there's I haven't used it in a long time. I would have to look it up, but I think there's like a mind body app you can probably do.
Okay.
Yeah.
But as far as I know, music is usually in the background and it's usually like a yoga studio or something.
Yes, yes, and there are recordings you can search on YouTube too, if you like, depending on what your preference is.
Okay, if you want to share the slides and we can kind of go through the didactic aspect of this thing. So we can kind of prove that there is a science to this. It makes you feel good for physiologic reasons.
Yes.
And just to plug Blue Ridge Creative Therapy, LLC, is there a website?
Yes, it's blueridgecreativetherapy.net.
Okay, great.
I'm gonna take my guitar off, so I don't have to worry about extra sounds coming from that I didn't plan.
Okay.
Alrighty. So I already introduced myself. My name is Bridget Brennan. I'm a music therapist and board certified, and I work in the Greenville area. I also help music therapy clients in Pickens County. All right. So we're going to go over the impact of music therapy as it pertains to oncology. So we'll be talking about how music can help in the healing process of cancer patients. So what we'll be going over is the definition of music therapy. And then we'll talk about what can music therapy help accomplish. So we'll talk about pain management, quality of life, anxiety, coping skills, and even boosting the immune system. Then we'll talk briefly about integrating music therapy practice into a holistic wellness plan for patients. And then we'll talk a little about what a music therapy session would look like. So to define music therapy, we do have a governing body. It's called the American Music Therapy Association, AMTA. And if you want to look them up online, it's musictherapy.org. So they have pretty much all the frequently asked questions there, and you can also search for music therapists in your area. And so we define music therapy as clinical and evidence-based use of music interventions, and we're looking to accomplish a non-musical goal within a therapeutic relationship by a credentialed professional. And these goals are individualized, so case by case, group by group. So this, like I said, it's a non-musical goal. So whereas a music teacher will teach music for the sake of, learn the rhythm, learn the instrument, we are using music as more like a motivator to get a goal accomplished. Just like you might see like in physical therapy or occupational therapy, whatever the medium is, we're still striving towards that same goal, but we're using music to do it. So some domains we might aim to work on would be physical or emotional, cognitive processes, and social needs. And we do that by doing things like listening to music, singing along or humming, playing instruments, composing, lyric analysis, things like that.
Bridget, is there any evidence that the patients, you talked about the lady or the gentleman with Alzheimer's that played the piano. Is there evidence that people who are musically inclined, perhaps play an instrument, get more benefit from this than people who aren't as musically inclined?
So I haven't seen any evidence of that. You do not have to play an instrument to benefit from music therapy. But that would be really interesting to see if there was any research being done on that, whether, musicians or people that have learned instruments
Yeah,
get a better benefit. That would be really interesting to find
if there's
out.
better intake for those folks, yeah.
Mm-hmm. That's a great question. Alrighty, so now I have a little video I'll pull up for you.
Music therapy practice in the United States was first kind of recognized in the 50s. That was when the National Association of Music Therapy was established. But music therapy work has been going on here for a long time.
You do the hokey pokey and you turn yourself around.
This process really throughout the brain.
I like that one.
And not only throughout the cortex, but also deep in the brain. Our cerebellum is involved in rhythm rhythmic processing. And some really interesting studies are being done about how music can change the brain. And they were seeing that dopamine was released when listening to music that was pleasant, that was found to be pleasant and enjoyable.
You want to start with that? Twinkle, twinkle, little star. The nature of being in the hospital is following rules and getting things done to you to help you feel better. What you are. For kids, that's hard. For adults, that's hard. And as a music therapist, we can really come alongside them and meet them where they're at. If they need choices, we can give them choices and let them choose an instrument. And it's a simple choice, but it's a choice. Up, down. You do it down. But I wonder what you are. Yay! That was beautiful. You did it. High five.
Back into my presentation. All right, so you saw a lot of things happening in that video. That patient was making choices. She was sharing creative, emotional expression. You can see she's getting a little bit of movement in. It might be just a little bit, but it's something. And she's having those connections with that therapist, and you can see she has a really cute kitty piano. So I really want to get one of those. Any questions so far?
Do you change the genre? I mean, obviously, we're talking about more nursery rhymes for a child like that, but say an adolescent, do you have to go hip hop or anything? Or do you have to, they say meet them where they're at.
Yeah,
So it's
exactly.
just one of those things where I wonder how often you have to adapt based on your audience.
Yes, so that goes client by client. So one of the main tenets of music therapy is using preferred music. And so the research shows that music from our younger years, like teenage years, young adult years, and even when we're younger than that, has a lasting imprint. So when I'm doing music therapy with an elderly person, I'm going to take into account her when she was born. And I'm going to talk to, she's not able to tell me herself, talk to her family members, her caregivers, and find out what genre of music does she like.
Right.
Does she want to hear crooners, or are we doing hymns, or, and that kind of goes across the board. So if it's children, you kind of have a blanket because you can do a lot of nursery rhymes, but you also want to take into account their specific tastes as well. So we have a broad range of music that we have to learn. And when I was going through my internship, you just go by the decade. So we did going back to the 1920s. I learned songs in the 20s, then the 30s and the 40s, all the way up. So it's constantly evolving, and we're evolving with our clients.
No, it was clear that my father, when he was going through his cancer battle, really enjoyed going back to the 40s. When he was in 18s and going to World War II and that sort of thing. So there was stuff on Sirius XM that the 50s on 5, the 50s on 5, or the 40s on 4, and we would just tune into that while we were driving around.
Yeah. Yep, exactly. So you know exactly what I'm talking about.
Right.
Yeah, and I mean, not to say that people can't benefit from hearing music that they've never heard before, but think about the reaction that you get when you hear someone singing a song Like
Right.
if you're walking on the street and you hear someone singing a song you're automatically going to attend to that a little bit more than just, random music, I guess.
And you may be transformed to a better time.
Yes, exactly. All right, so I'll keep going. So we know that cancer patients are enduring significant physical and emotional distress. So lots of pain, possibly anxiety, depression, fatigue. And so we offer a complementary treatment to that, and it helps improve their quality of life by reducing pain and anxiety, possibly reducing nausea, definitely enhancing mood and relaxation, and just maintaining the well-being and quality of life of patients. And as you mentioned before, I mean, it's something observable. You can see when you yourself feel better after listening to music. And music has really been used since ancient times to soothe. And one other thing about music therapy is you don't have to have experience playing music or being a musician. You can still benefit. I'm just checking my notes. Oh, yes. And if, let's say this patient is nonverbal, you know, they might be able to express themselves on an instrument or by picking songs that were important to them. Different things we can do. And also receiving that sense of choice, even though it's like you said in the video, even though it's small or simple, it's not small in that moment because it is a choice.
So I suspect you're a consumer of music and you listen to all kinds of music. You know, it's interesting. I mean, my wife and I are putting together, not that my grandchildren are that close to college, but when they go to college, they're going to get a playlist from Nana and Papa. And I wonder if leaving them with something that you've determined that they like, a genre that they like, or an age that they like, if leaving them with some kind of playlist would kind of help them get through till your next appointment.
Yes, absolutely. That's absolutely been done before. I've shared lots of playlists that I put together with clients, you know, and I'll like send them to the caregivers or make a YouTube playlist so they can access it anytime and play them. A lot of times some clients will have, they'll have anxiety about like when they're receiving personal care. So I like to tell caregivers, hey, here's a playlist for them. Play about 10 to 15 minutes of it up until the point where you're like going to start care so that they get a little head start into being relaxed with something familiar. But that's tricky though, because if you go past about 20, 25 minutes, then it becomes kind of like a background effect.
Right.
So we really recommend like staying within that 20-minute time frame.
Great.
All right. So I really loved this picture. I'm not sure if there was a music therapist present during this. I would hope that there was. But as you can see in that picture, that's someone who's having a brain tumor operated on, and he's playing guitar so that the doctors can keep track of his functions in his brain and try to preserve as much hand and brain function as possible.
Is that an electric guitar?
It looks like an acoustic. I don't know if
Okay.
it has any pickups to make it electric or not.
That is a very cool picture.
Yes.
And obviously they're operating on the brain, and you think the brain, the source of all nerves, would have pain receptors, but it does not.
Right. Yes, I know. And I know that's a little bit funny to put that slide here, but I had to put it somewhere.
Yeah.
But yes, we do. It does help with pain management. So like I was saying about how we go through and carefully select and design these interventions, it's all patient preferred music. And we kind of work with caregivers as well whenever possible to bring something that's going to be the most beneficial to that patient. And I thought it was important to note that, you know, with music therapy, it's non-invasive, and it may reduce the need for medications. So that could be helpful depending on the patient. Alrighty, so we talked a lot about taking care of our emotional well-being. So we're just promoting that sense of hope, joy, and doing something that they either liked to do in the past, or now they have a new joy for it because maybe maybe they make weekly trips to the hospital, and maybe this is one reprieve from all the medical things that they need to happen for them while they're here in the hospital. And then offers them a chance for connection as well. Expressing your feelings. Maybe you rewrite a song or do song lyrics. You write your own or like parody another song. So all of those go together and help maintain quality of life. And one of the biggest ways music can help is by helping to relieve anxiety. So we can induce relaxation responses and even help regulate respiration and heart rate. One time when I was at the PEDS unit, I went in with my teacher, and there was a little baby, and we were supposed to be helping her regulate her heart rate because it was very fast. So it was my first time working with anyone that young, and so my teacher and I got on either side of her, and we're just like humming softly, and I had a little ukulele and I was improvising on it, and it was so cool to watch her heart rate actually slow during the music.
That's mild feedback right there. Yeah.
Yeah, and as a student too, you're like, okay, yes, it actually works. And I wanted to mention one of the principles that we use. It's called the isorhythmic principle. So I use this a lot in hospice, but it can also be used just in a general, like, read the room type of way. So like if I come into a room and maybe there's distress because of their respiration is rough, or like their heart rate is too high. Well, so the isorhythmic principle says that we would start with where that client is at. So I might be looking at a clock and timing their breaths. And so when I start playing the music, I'm going to play my rhythm to whatever their rhythm is and their heart rate or their breathing. I'm going to match it to that and then slowly bring it back to help them relax. So I would slow down my tempo, helping them slow down their breathing. So that's one way we can help regulate those vitals. And then you can use it as like we did with the progressive muscle relaxation, thinking about meditative and mindfulness aspects while using music. And then, of course, listening to, choosing, sharing music that you like is going to improve your mood. It also provides a routine. So like you're in the hospital and people are coming to your room, and of course it's all stuff that needs to happen, but you don't really have a lot of control. So offering that control. And then, so we would come up with like a short-term realizable goal. So that might look like patient will take 5 deep breaths during a guided meditation, or a patient will verbalize one source of strength via lyric analysis.
Bridget, one of the things that people get from music is not only the tune and tapping your feet and dancing and that sort of thing, but also the lyrics. And I know that a lot of musicians are also poets. We have convened some journaling to help people write, help them in being encouraged to write down their thoughts. I just wonder if you supply them with a melody and challenge them to add their thoughts in the form of lyrics.
Yes, absolutely. That's one intervention that we can use. And depending on the person or the group, we can have them compose the melody, You know, we can offer ideas like, oh, do we want the melody to go up? Do we want it arching, or do we want it to go down? Or maybe just like drumming out a rhythm. Maybe they set up the rhythm aspect of the music. You know, and then if we were in a group, maybe different people add in different words to help compose the poetry that goes into the lyrics of the song.
Right.
So it's absolutely, you're spot on with that. Okay, I'm gonna go to the next slide. So yes, music therapy has been shown to lower cortisol levels, reducing anxiety, and then it increases the body's production of immunoglobulin A. So I have some links that I could share later. I can email that to you if you'd like, Jeff.
That'd be great. Yeah. We do pride ourselves in making sure that this is science-based, and obviously in your video, they talked about dopamine increases, but decreasing the stress hormone is very valuable.
Yes. So music therapy is a great way to complement the traditional treatments, possibly bringing back the need for medications. And it offers a holistic approach to the healing. Of course, like I mentioned, it's tailored to meet each individual's needs. So I like to look at music therapy as a holistic partner. So, and I think Jeff, you mentioned this too, it can help to increase the patient's acceptance of the clinical plan, like seeing, oh, okay, we have a way that I can process my emotions through music therapy, and it doesn't have to all be pharmacological, I guess. And it has also been shown to reduce caregiver strain. I believe those studies were more for the elderly receiving music therapy, the ones I'm thinking about. But if you think about a patient, and if the patient is happy with their care, then it's going to be easier on all the caregivers around them. And if a caregiver happens to be in the room, they get to, they get to be a part of the music and at least listen, if not, participate and just get to learn a little bit more about that patient. As we talk about like their likes and maybe their memories that are associated with those songs.
Well, we have to understand also the providers are stressed. They probably would love to have, something that is lowering their cortisol too. They want to get it right. They want to get, the therapy correct. They want to make the right decisions. If that helps them clear their brain, all the better.
Yeah.
So, kind of a nuts and bolts question. Obviously, this is your career. And I know these interventions are not reimbursed, and the process of dealing with an insurance company in your field would be administratively too great. So how do people access you, and what is the quote going rate? I can tell you that if we're smart about this and we reduce the amount of pain medications or anxiety medications or antidepressant medications, it's a win for the whole health system. But how do we access you, and what does that mean from a standpoint of a cost benefit ratio?
Yes. So I didn't have any direct paperwork that showed like our particular hospital. I think obviously you guys had music therapy at one time, but I don't think it was only the Cancer Prevention Center or the cancer unit. I think we walked around different parts of the hospital. So I'm not sure how tracked that was, but I did find one study that showed patients who had respiratory ventilation who also received music directed care had reduced medical costs. You can see it at the bottom of my slide of about $2,300. And that was a study by the National Institute of Health in 2018. And to access my services, I am a private contractor, so I'm private pay. In South Carolina, we're waiting for music therapy licensure to come through so that we can more easily be covered by insurance companies. And right now I work mostly in the school systems because we have IEPs, and when those are required, then the school systems are required to provide those services.
Do you have a rate that you are giving to the school system?
Yes.
That you're giving to the Meyer Center?
Yes, so the going rate for music therapists in this area is anywhere between, well, a couple years ago, it was like 80 was on the low end, going out to about 120, I think.
Per hour?
Mhm.
Okay.
Yeah, so I would love to have music therapy be more accessible, and I think doing groups too is a great way to accomplish that because you're getting, more bang for your
More bang
buck.
for your buck.
Yes.
Perfect.
Did I answer your question?
Yes.
Okay. All right, so we'll receive referrals from the staff, or maybe a patient family makes a request. And at that point, we would go in and assess that patient and determine a treatment plan. And that assessment is ongoing. So it's really important that we're using live music to the best of our ability. So that's one thing that we're taught, is to try and use live music so that we can meet needs like different respiration needs, and being able to change and mold the music in that moment to whatever that patient is going through, so that we can validate what they have happening and then help them move past emotions or pain, and etc. And I think I mentioned before, when I did my practicum when it was GHS, we walked around to like different units. We walked around all over the place. But we would get a report from the nursing in the morning, and we would kind of triage depending on, is there someone with higher pain that's not being treated well with medications, that's a prime reason to send in music therapy. Or maybe some respiration, or maybe the patient and or family is having some coping issues. So we triage the needs. And so you might be wondering, well, what does an actual music therapy session look like? So we can do individual music therapy, or we can have it in a group. And we'll do things like listen to a song, and then I might have some prompts, what does this song mean to you? Does it remind you of anything? Or even like going through the guided music meditation, using music to be mindful, teaching patients about the isorhythmic principle. So putting that into use might look like saying, okay, well, if let's say you're feeling angry about something going on with your care, or something going on in your life. Well, you don't want to just push that emotion away. You want to let yourself feel it. So you can put on an angry song, put on a song that helps you feel it, so you feel it deeply, and then see how you feel after that. Do you want another angry song? Or maybe you want something just a little bit more mellow. So teaching them how to have control over their plan of care too is also empowering. And of course, we can play instruments, any kind of humming and singing that is going to reset the vagus nerve, which brings our body out of fight or flight. And then we can do songwriting or lyric analysis. If you see in the picture here, you can see when it's springtime in blank. So there's like different levels of writing a song we can do. If someone might be feeling intimidated by writing a whole song, then we can provide them something with just a few fill in the blanks, and they can put in whatever they're feeling, or something that they're going through, guided through prompts. And we could also do song parodies as well. Kind of goes with the fill in the blanks too.
Oh, wow.
Mhm. All right. So we're concluding now. So music therapy does have the potential to enhance the well-being of oncology patients, and we're going to be addressing physical and emotional and social needs. And we're a valuable adjunct to traditional cancer treatments.
And if you actually want to see Bridget, we do have some music therapy within the Cancer Survivors Park. The last Friday of every month, I think it's been rain or shine, and cold or hot. We're getting into the hot season now in our area of the park, right next to the Healing Garden and the amphitheater.
Mhm.
There's a drum circle that's put on by Jeff Holland, but Bridget participates in most of those.
I
Um,
do.
and there's more than drums, that I know you play other things as well. You might actually bring your flute to that.
Yeah, I do. Yeah, I bring my flute. People
And
bring instruments and they provide the instruments too, so you don't have to bring in
I
anything.
know, Jeff just unpacks the van and brings it all down and so that is one thing that we're doing, but we clearly need to access this capability more and more within the park. I'm glad that you put up your some of the references and your phone number and your website, so that hopefully we can generate some business for you, as well as you're helping more patients in the area, especially our cancer patients. But all right, so at the end of this, the audio was a little issue at the beginning, but it is good now, and you're probably very much relaxed, so you have saliva. So let me hear an Irish whistle.
Oh. All right, well, luckily I have one right here because
Oh,
as
yeah.
it turns out, you
I didn't
don't
realize
have one.
it took another instrument, but I thought it was just going to be self-generated.
Yes.
So what's that called?
It's an Irish whistle or penny whistle.
Okay.
Mhm.
All right, you're going to play us an Irish tune? We're not hearing that. We might be frozen again. So you froze a little bit. I'm going to have to, you're going to have to take two. Let's see what happens.
Okay. It might be just the sheer volume of it.
Okay. Yeah, folks, we're only going to get one note. And that's a shame. But if you want a live performance, we can try to challenge Bridget to bring the Irish whistle to one of the drum circles. So thanks so much.
Anytime.
This was a great addition to our content. Clearly something that, again, is pretty intuitive from the standpoint of music changing emotions. So I appreciate all your work for you to get board certified, and hopefully we'll garner some enthusiasm for younger folks, not that you're old, but younger folks to get involved as well and go through this training. So thank you. Before we leave, next month, our topic is going to be available probably around July 11th. And we're going to talk about what safe integrative therapies are out there and right for you. So this will be somewhat referenced to science, but all the integrative therapies that you think you know and some that you don't. And we'll leave you with a couple of quotes. This one is from Steven Spielberg, who probably everybody recognized. And he said, "There is no such thing as science fiction. There is only science eventually. So just wait for it and it'll come true." And then apropos to music therapy, this is from Wolfgang Amadeus Mozart. "The music is not in the notes, but is in the silence between."
Mm.
That may be one that you've heard before. So with that, Bridget, thanks so much. And we will let you have your day or evening back.
Thank you
Thanks so
so
much.
much.